Hi, my name is Dr. James Maggio. I'm a chiropractor who practices in Virginia Beach, Virginia. One of the most common health issues that we treat here in the office is when people have what they think is carpal tunnel syndrome. This is a very confusing health issue that people suffer with, so I'd like to take a couple moments to explain it to you. One of the most common causes of symptoms where someone gets tingling or numbness in their hands or wrists or all the way up and down their arm is from this, called a pinched nerve. Normally when we look at the spine, it should be extremely flexible. Those vertebrae should be moving back and forth nice and smoothly, and when it does that, it puts absolutely no pressure on these structures, which are the spinal nerves. But sometimes what happens is they get stuck. And if those vertebrae get stuck, whether it's from trauma or repetitive motion, it puts pressure down on that nerve. What happens then, I'll show you on this computerized screen. Once again, this is the template that I just explained to you, is normally all these vertebrae are moving good, but sometimes they get stuck. And when that happens, wherever the nerve goes can cause pain, numbness, tingling, discomfort, and even when it gets really bad, a loss of grip strength. We have in the office a remarkable tool called the Pro Adjuster. It's made by a company called Polestar. It's a phenomenal instrument that I've had the privilege of using for over 15 years. What this instrument does is it allows me to scan through a person's spine with this instrument that's hooked up to the computer, and it gives us instantaneous readings if the spine is moving really good or if it's stuck and pinching the nerve. It's totally painless, computerized, and extremely comfortable. If we look at this screen here, this is a sample of a scan that we just did. This is the scan where we're trying to figure out what's causing the person's tingling or numbness in their hands. And you can simply see where these vertebrae are flagged in red is where that bone is stuck. So once we find the bone that's stuck, what happens is we can take this instrument and put it right on the part of the spine that's stuck, and it percusses or taps at an extremely high speed, up to 90 times a second. The patients barely feel it. Most people think that it feels extremely comfortable. As soon as the computer gets a reading that the vertebrae is moving properly again, then it shuts down. And then what we get to do, which is another remarkable feature of this instrument, is we get to reanalyze the spine to make sure that the red is gone. When we see that the red is gone, that means that the vertebrae are moving much better and the pressure is alleviated from the nerve. I know having a challenge with carpal tunnel or tingling in the hands can be very confusing because it's a hard issue to diagnose, but I wanted to let you know, rest assured, we have an instrument that does a remarkable job at figuring out what's wrong, and then we can also treat with it as well. Thank you for your time and attention, and hopefully in the future we'll be able to help you with your carpal tunnel symptoms or carpal tunnel issues that you have.